Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources. On today's edition of Helping Seniors TV, let's learn about Florida SHINE program, serving health insurance needs of elders, and the kind of help they can provide in choosing best Medicare and health insurance options. Lance Jarvis, Brevard Area Co-Director for SHINE, joins Helping Seniors TV program host and longtime senior advocate Joe Steckler for a discussion on this important topic.
Good morning and welcome to this edition of Helping Seniors, our television show. My panelist today is Lance Jarvis, and Lance is the area coordinator for the local SHINE program, which is an acronym that stands for what, Lance?
Serving Health Insurance Needs of Elders. And I'm delighted to be with you again today, Joe.
Well, it's always a pleasure, Lance, to have you on our show, because I think not only do our viewers learn a lot, but I learn a lot, and we can always acquire more information. We just never have enough information as we get older, and you know, we couple the information that we can gain with the information that we lose, and it sort of balances out.
Sure it does.
But it's always important to stay ahead of the power curve and to be as well informed as we possibly can. And to that end, you know, I know that many people know what SHINE is, but you stated what the acronym SHINE is: serving health insurance needs of elders.
Yes, that's correct.
But what exactly does SHINE do?
Oh, I'm glad you asked. Thanks for the opportunity to share that. SHINE is part of the Florida Department of Elder Affairs. And the Department of Elder Affairs has a secretary that reports directly to the governor. So we're part of the Florida Department of Elder Affairs. But all of the counselors, and there are 550 of us throughout the state, are volunteers. We are unpaid. Our mission is to help seniors and others who are either becoming eligible for Medicare or have Medicare to understand how Medicare works, to answer their questions about Medicare, to help them make good decisions about how they will get their Medicare benefits. So we have in Brevard 35 counselors who do just that. And we operate out of about 10 different offices from Titusville down to Palm Bay. And we see clients at these locations, and we also speak to clients by telephone. So we stay busy year-round, but are particularly busy during Medicare's annual open enrollment period, when people have an opportunity to change their plans for the coming year.
We talk about this enrollment period, open enrollment. I would like to just quickly go over open enrollment, what that means, and the time period, but you can still help people outside of the open enrollment period, correct?
Oh, absolutely. The open enrollment period is a time between October 15th and December 7th, when people who have Medicare and have Medicare plans can make changes. Prescription drug plan, they can change Medicare Advantage plans, they can switch between original Medicare and Medicare Advantage plans. But during the rest of the year, we stay busy helping people who become new to Medicare, right, who are what we call aging into Medicare, and helping them to understand how Medicare works, what options they have to get their Medicare benefits, to answer their questions, to clear up misconceptions that they have about how Medicare works.
But part of that, a big part of that, is to help people get on the right insurance plan.
Yes, that's correct.
You know, Lance, it seems that our care plan for the United States is in a state of flux right now with what's happened over the last 8 years, now in the 9th year, as we have a new president, and with the Affordable Care Act, and now wanting to change everything. I try to follow what is in the papers, what's on television, I read it on the internet, and somehow the numbers don't jibe to me. I just have a horrible feeling that we might be making mistakes when we don't really need to make mistakes. And one of the things that you do as a SHINE counselor is you help people get to the right program. But say, for instance, in the state of Ohio, it is purported that you don't even have an insurance agency serving the state of Ohio now. How in the world do the people in a state would have no insurance agency serving? How do they exist?
Joe, what's happening now in Congress with the proposal to eliminate or substantially change what is called Obamacare, what is really the Affordable Care Act, officially the Affordable Care Act, doesn't affect Medicare.
That's exactly right.
So we are, at the moment, Medicare beneficiaries are unaffected by what's going on in Congress as they debate whether to continue or modify or eliminate entirely the Affordable Care Act called Obamacare. So for Medicare beneficiaries, nothing changes, at least as of now.
Right now. But and having said that, when you look at what the federal government has invested in the SHINE program nationally, we have 50 states and we have roughly a $50 million bill. It's roughly $1 million per state to fund the SHINE program.
Yes.
And one of the things that's supposedly happening under this new plan to change our healthcare system would be to eliminate the SHINE program. And that would be a horrible mistake. And when I found out about that, I said to you, could SHINE operate simply on a local level? And you said yes. So I said, one of the things helping seniors would help you do would be to raise the money, and you estimated it would take roughly $10,000 to keep a local program going. Think about the cost effectiveness of that one single program and what it could mean if we could do a better job with our whole entire healthcare system and our information system. It's a thing. But you've also alluded to the fact that our state is a lot smarter, and they're not going to let this program go away. So having said that, without letting any cats out of the bag, we will continue to have the SHINE program.
Well, I certainly hope we will.
Yeah.
SHINE is federally funded. At present, no money comes from the state.
Right.
It's historically been a federally funded program at a cost of roughly $50 million nationwide. And that supports training, that supports many different aspects of the program, but not the volunteers. For example, we have computers that we use. Well, those are paid for out of the SHINE funds. The proposal under the budget that President Trump has presented does away with the SHINE program. That $50 million is gone from the proposed budget, which is very sad for those of us.
But I don't think it'll pass. I don't think we'll lose SHINE.
Well, I hope not, because it's a bargain when you think about what it would cost the federal government to replace the work that is done by 10,000 volunteers nationwide who do this work. If we had to have federal employees do it, think about what it would cost to hire all of the people that do the work that we do. Plus, we are local. We're here in the community.
Exactly. And people know you and they trust you.
We can sit right across the table from a client. You can't do that when the...
But I don't mean to cut you off, Lance, but one of the biggest things that you help people understand is that there is a difference between Medicare and Medicaid.
Yes.
So many people do not understand that Medicare is one thing and Medicaid is something else. But one of the things we want to talk about today is, I can't imagine what would happen if the SHINE program went away. I just can't imagine, because I don't know. I don't think we have enough local information programs that could fill that gap. I really don't.
I don't think so either, Joe. The assistance that is provided by SHINE counselors, who are volunteers, is completely free. It is totally unbiased and objective, which is to say that SHINE has no connection with any insurance company or insurance agent that could bias our counseling, could bias any recommendations that we might make. That's very important, because people know that we are a source they can trust, because the only person that we need to serve is our client. The client is our master. Finally, anything that's shared with us by a client is held in the strictest of confidence. We have more training in HIPAA, patient privacy, than your doctor does. So we can be trusted with the information that you share. And the only reason that we ask for that information is to better understand your needs, so that we can present you with alternatives and options that best suit your needs.
Okay. Let's just talk for a few minutes then about some of the not often discussed benefits of having a SHINE program. And one thing that comes to my mind is that the Medicare Advantage programs, generally speaking, are cheaper than most of the other programs. And so a lot of people take those programs, but let's say if a person traveled a lot and they're, say, 68 years old and they're prone to having some medical problems. My understanding of all the different types of insurance would lead me to believe that person would be better served if they were in the regular Medicare program, because if in a regular Medicare program, no matter where they went in the United States, they would still be covered. But if you're in a Medicare Advantage plan and you do a lot of traveling and you're prone to sickness, the only thing, and correct me if I'm wrong, the only thing that is covered is an emergency service, if you're out of area.
If you're out of area with a Medicare Advantage plan, let's say it's an HMO Medicare Advantage plan, Health Maintenance Organization type of plan, the only services that you can count on getting outside of the geographic area are emergency services. And that means that it is a legitimate, genuine medical emergency, such that a reasonable person would believe that their life or health would be severely endangered if they did not go to an emergency room. Which means that if you have a cough and you're in Lincoln, Nebraska, and it's a bothersome cough, and you'd like some assistance in getting rid of that cough, and go to an emergency room, you will not be covered. That is not a medical emergency. And if you go to a doctor in the community or an urgent care clinic, you will pay out of your own pocket. So if you're prone to lots of sicknesses that would not constitute medical emergencies, you'd want to think very carefully before choosing an HMO Medicare Advantage plan. And
the people that sort of live close to the margin on their monthly income, And if they don't know about the SHINE counselor, they don't know where to go to get this kind of information. They just possibly rightfully think that the best deal for them in order to conserve their money would be to have the Medicare Advantage plan, when in fact, if they went to a SHINE counselor, they would find out there are many other options available to them. That's one of the side benefits, I think, of the SHINE counseling program.
That's a very clear benefit, Joe. We will discuss the pros and cons of the various options that an individual has to get their Medicare benefits. So one of the questions that I would ask, and I think any SHINE counselor would, do you plan on doing a lot of traveling out of the area in your retirement? Do you have children out of state that you might be visiting for months at a time? Yeah. If so, we won't definitely not tell you don't choose a Medicare Advantage plan. Rather, we will tell you that there may be some disadvantages to making that choice.
Yeah.
In spite of the fact that month to month, you may save money on the premiums. But do you want to be in Flagstaff, Arizona, or Lincoln, Nebraska, with an illness, knowing that your insurance won't cover you?
Okay. Another common misunderstanding, I think, involves when a doctor orders a blood test. I think that you have some stories or some things you could talk about on that too.
Oh, yeah. When it comes to recent story, client comes to the office with all kinds of paperwork. He had some blood work done. Medicare would not pay for it. He says, I thought that Medicare pays for blood work. Well, the answer is Medicare does pay for blood work under Medicare Part B at 100%. There should be no copayment, and the patient should not be responsible for any out-of-pocket cost for blood work. But there's a catch. Much of the blood work that doctors order is considered limited coverage blood work. That is to say, when the blood work is ordered, the doctor provides a rationale or a diagnosis that explains why he or she ordered that blood work. Medicare looks to see that the diagnosis is appropriate for the blood work that was ordered.
So they do check.
Oh, you bet they check. If it is not appropriate, if the diagnosis is not appropriate for the test that was ordered, Medicare will deny it. And when a person goes to the lab to get that blood work, even though the doctor ordered it, the lab will probably say, Medicare won't cover this test. So here's an example, and it's an extreme example, and I can't say that this actually happened, but it's an easy way to demonstrate. The doctor sends a man to the lab for a PSA test. A PSA test
Prostate?
is for the man's prostate. It helps to assess whether or not there is a cancerous condition in the prostate.
Okay.
That is a covered test, but not with the diagnosis of a well-woman exam.
With a what?
Well-woman exam.
How can you do that?
Mistakes are made.
Well,
Mistakes can happen because
how do I find out about that?
Well, when you get to the lab and they input the test that you're supposed to have and the diagnosis that the doctor has used to justify that test, the computer will flash a warning and say, this will not be covered by Medicare.
Well, should the client, is there Should they be asking these questions when they go get their blood work done? Is there something that I could ask?
You could, but generally speaking, the lab will tell you that you're not going to get that test covered by Medicare for the diagnosis that the doctor provided. So at that point, you have several options. One is to say, well, I'll pay for the test anyway, which most people will not want to do. The other option is to say, I'm going to see my doctor, go back and find out why the diagnosis that he used isn't one that Medicare will accept. If you say, I would like to have that test covered by Medicare, I'd like to have that test anyway, the lab will ask you to sign what's called an advance beneficiary notice.
I was going to ask you, what is that? Is that what it is?
That's the secret. So the lab will present you with an advance beneficiary notice which says this test, which would cost you about this many dollars, let's say $60, will not be paid for by Medicare because, and they'll fill in this information, and you have the choice to say, I don't want the test, I want you to bill Medicare anyway, I acknowledge that Medicare won't pay for it, so I agree to pay for it.
So what should they do?
Well, in the case that happened recently, the client said he would agree to pay for it.
Okay.
Sure enough, he got the bill for about $85 for several tests. He came to me and said, why wouldn't Medicare pay for this? I said, did you sign an ABN, an advance beneficiary notice? He said, of course I did. Do you have a copy with you? Yes. He agreed to pay. The reason that Medicare denied the test and that the lab told him they would deny the test is because the diagnosis that the doctor used to justify the test was not one that Medicare covers.
So what should he have done? Sign, he wanted Medicare to pay for it?
Say, I don't want the
Just
test.
decline it and go back and see the doctor.
That's what I would do.
Okay.
And the reason he didn't was because he was having surgery in a couple of days and he did not want to delay getting that blood work done.
Okay.
So the surgery was already scheduled. Now, all is not lost because he can still go back to the doctor. Ask the doctor to provide a diagnosis that Medicare legitimately would cover. Send that back to the lab rebills Medicare, problem solved.
Would they refund his money then?
Well,
if Medicare approved it?
He didn't pay.
Oh, he didn't pay it?
He didn't pay. He came to us with the bill from the lab saying, oh, I don't want to pay this $85, even though I agreed to. Well, bottom line, that lab can be rebilled with a corrected diagnosis to Medicare, and the problem goes away.
But I think this is a time. We don't have much time left, but there's one other thing I want to ask, and that's about ambulance services. But in this case, I think we have to realize, Lance, that many of us can afford to pay for these tests, and those that can afford to pay for these tests should think more about taking up some of the burden on our own pocketbook instead of putting it all of it back on Medicare. That's my personal thought.
Well, certain tests will always be covered by Medicare if they are medically necessary.
Right.
And the way that medical necessity is proven is with the diagnosis that the doctor uses.
Okay.
So you shouldn't have to pay for the lab work if there is medical necessity shown. Occasionally, a doctor will order a test that he or she knows will not be covered by Medicare, but in the doctor's judgment, that test is necessary.
But that doctor should tell the patient.
Yes.
That's right. One question that I do want to talk about ambulance services and Medicare outside the United States. And we only have 2 minutes left. Can you discuss ambulance services real quick, and then what happens if you're outside the United States on Medicare?
Sure.
I'll leave it up to you to do that.
I'll do the best I can with less than a minute and a half. Ambulances are covered by Medicare only if there is a sudden medical emergency that requires that there be, where every minute counts.
Okay, like a 911 call.
It is not covered if you skin your knee and have discomfort and your neighbor says, well, we need to get you to the hospital and call 911.
Non-emergency.
Lots of folks don't recognize that an ambulance is a very expensive mode of transportation, and Medicare will only pay if, again, it is medically necessary.
Okay, now let's go to what happens about Medicare outside of the United States. You really got to quick.
Bottom line, Medicare does not pay for medical care outside the United States. Some Medicare Advantage plans do.
Oh, jeez. So it gives you another cause for going back to Medicare Advantage. But you got to know the system.
You have to read your benefits booklet, which people don't do. They don't understand Medicare will pay for emergency services out of the United States with many Medicare Advantage plans. Original Medicare does not. Bottom line.
So what amounts to, you need to talk to a SHINE counselor, and even, and you got to read the fine print. Lance, I want to thank you for this. We really ran close to the line. We're just right on the wire, but it's always a pleasure to have you here, and I always enjoy it because I think our viewers do learn from the little things that you bring to the show. I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.